Hello, this is the call on African Renaissance TV. This episode is actually focused on a tool development by the National Public Health Lab, and this tool is called the National Essential Diagnostic Tool. This activity is a week-long workshop wherein different stakeholders are invited from different regions to come and attend this workshop wherein they will develop a tool. This tool will serve as a guiding principle for laboratory services in the Gambia. So the activity is a 5 months activity that would include surveys, it will include data collection, and lots of other activities. I am Tona Dabo, and I will take you through this process. Here joining me is the Director of National Public Health Lab, Silfo. Let's get to understand more about this tool. Actually, the whole program or the process is funded by FINE, and they hired a consultant from Datos to come and do this with people in the Gambia. Let's get to understand more. Good afternoon, sir. Thank you for being here with us. I know this week is a very important week as far as the National Public Health Lab is concerned, because this activity that you're conducting, which is the development of a tool that would guide your laboratory services in the Gambia, it's as a result of issues that arise in the Health Technology Assessment Report in 2019, and then the Joint Internal Evaluation Report in 2017 by WHO assessment. So we would want to understand how you would define your feeling on this day today.
Yeah, today is a very important day in the history of laboratory service delivery in the Gambia. Because I see why I say that is the team that is here, they are making history. Because what we are doing today, this is the first time for Gambia as a nation to start developing what we call an essential laboratory diagnostic list for all the disease diagnosis across the country, looking at different tiers of the health system. That is looking at the minor health facility, major health facility, district hospital, general hospital, and teaching hospitals. Because what we are trying to do is to categorize the diagnosis at different levels such that we will be able to respond to the needs of the country. And research has shown that, that was published in Lancet, that about 47% of the population, especially in developing countries, don't have access to laboratory service delivery. So in working in a direction which will make our people to have easy access to laboratory service delivery is a very important day for you people. And then for the rest of the laboratory fraternity. And
as far as addressing gaps are concerned, it's really...
Exactly. In order to improve the health service delivery for the Gambian people.
All right, thank you very much. So in one perspective, we know that the use of accurate and quality diagnosis is the first step in actually development and implementation of strategies of disease treatment and control in many cases, or even prevention of outbreaks when it happens. So again, probably we would just want to highlight one or two importance of why we need to make or why we need to have such a tool in every laboratory or in every lab as far as health centers or hospitals are concerned in the Gambia.
Yes. So one of the most important of this tool is that it will advocate for the provision of things that are needed at the different levels of the laboratory service delivery within the health sector. Because after developing this tool, the government is expected to provide all the necessary things that it takes to provide laboratory service at different tiers. Because each of these, the document which clearly spell out what type of test needs to be done at different levels. And as a result, government will provide that, and then which will make services accessible for our Gambian people, and then it will also make surveillance very easy in terms of diagnosis at different levels of the health sector.
Yeah, so talking about having accessibility for the general population, and also knowing the fact that access to quality tests and laboratory services is like having a radar system that gets you where you want to go to. without which you realize that you're flying like a bat. This was said by the WHO director.
Yeah.
So based on this, are you really saying that laboratory services are most likely or are always accessible to all people in the Gambia? Vulnerable people, people that are in the rural Gambia more specifically?
Yeah, for now, what we can say, the system that we have in place, the little service that we can provide at different locations that are accessible to every Gambian. But what we are saying is like we have not categorized types of tests that needs to be done at different tiers of the system.
Okay.
So you will realize that when you talk about accessibility, somebody in a remote area and then he wants to perform a particular test, and then let's say this should be done at that facility, but it's not available. So it means that that guy don't have access to that test.
Exactly.
Because although it needs to be done, but the test is not there, so that accessibility is not there. So what we are saying is, after developing this NEDL, that is National Essential Diagnostic at different levels, then you realize that all the things that are required in terms of human resource capacity, in terms of reagents, in terms of equipments, then they will be provided. We'll advocate for the provision of those materials at different levels so that people who need the services at different locations, they will have access to those services.
So with this advocacy, is it going to be with the government or other development partners?
Yeah, what we do is like the advocacy normally is not only the government. The advocacy goes beyond the government. The advocacy is through the government and also our partners in the development of health system across the world. Like we right now, we know that the World Bank is helping the country in terms of providing equipments and reagents in order to increase the capacity of laboratory diagnosis in the Gambia. And that will also go a long way in providing accessibility to diagnosis at different levels.
Different level.
Yeah.
Nice one. So we know that having this list at all the major laboratory, let's say, centers in the Gambia, you know, this is going to give them a great deal to be able to give the services that they are supposed to be rendering to the general people. So how would we make so this tool, after being developed and let's say accepted, it's always available to all these stations that are rendering laboratory services? Because we know that at every point of care, in every laboratory, it is easier if they have some of these documents that they can always reference, you know, when they're giving their services. Would this be like a printed Bible in their offices or something like that?
So the format that we want to take is, after developing the essential diagnostic list, it is approved. This document will be printed and it will be provided at different levels of the health service delivery, not only at the health facilities, even in offices, at different offices that are manned by healthcare workers. It will be available. But the most important part, it will also do what we call sensitization. You have to sensitize the general public, you have to sensitize the health worker, so that each and every individual knows what type of tests can be done at a minor health facility, what type of tests can be done at a major health facility. So I think if we do that sensitization and then make the document available to each and everyone, that will at least increase the accessibility and people's knowledge about the NDL. And then the implementation will be easy.
Okay, so Mr. Jang, last question before we let you go. So we want to understand the composition of the people that are attending this training here, because we realize that not all people that are rendering laboratory services would be available for this training. But those that are not really fortunate to be here, what plans are there for them to be able to have quite a little bit of knowledge that these people are enjoying here? Are all the regions represented well?
Yeah, so what we are doing is, like, as you said, we cannot invite every health worker to be part of this document development. We are working on a tool which is called e-tool, that is used for developing essential diagnostic list. And this tool has been developed by FIND, that is Foundational Innovative New Diagnostic. This is a funding body that helps especially low-income countries to provide facilities or to provide funds for them to develop certain document. So not everybody can be here, that's true. But the composition of the people here is almost across all the health service delivery. What I mean by that, we have clinicians here, that we have medical doctors as part of us. The Director of Health Services was present here during the first day. We have people from the pharmacy, they are also present here. We have people from the laboratory services, different cadres of the laboratory service, from the planning unit, from the laboratory side, from the information system management. We have all these people as part of it. We even have people from the private sector that join us in developing this, because we know that when you talk of health, we talk of almost every individual's concern in health service delivery. So this is why we invited all cadres of the health service delivery. But the others who are not here, as I said, this document will be available. And then there will be sensitization. We will sensitize them. And for the laboratory people, we advocate for training so that they understand the document, so that they can use the document as we want the document to be used. Yeah.
Thank you very much, Mr. Jai.
Thank you.
I really appreciate your time with us, and we hope this is a successful training at the end of the day.
Yes, thank you very much. So just to add that this training is being funded by one of our partners, Foundation of Innovative New Diagnostic. They are our long-term partners. And then they funded this by providing a consultant. We are working with a consultant from FINE, and this consultant is the individual who even developed the tool.
Wow.
So we are working with the consultant, the first person who developed the tool, in order to develop the essential diagnostic list for the Gambia. And we are quite sure after this development, the document will be shared with different people. And then because we want everybody's input into this document.
Sure.
So even those who are not here, after the draft is being made, it will be shared with people at high levels, with donors, with partners, so that we get all their inputs into the document, so that it becomes a document that has everything, and it will go a long way in developing or improving the diagnostic services
of the Gambia.
Yeah.
Thank you very much. Yeah. All right. So we are here with one of the trainers, or the only trainer, and one of the consultants for this week-long activity. Ali, you will tell us who you are and what you do.
Yeah, sure. So my name is Dr. Chirdatema. I'm an advisor laboratory strengthening and also the CEO of an organization called DATOS, which is an organization that focuses on strengthening laboratory and diagnostic services across the whole world. We work a lot in Asia, in the Middle East, and also in African countries to strengthen all aspects of diagnostic services provision. And we have been hired by FIND to assist FIND, the Foundation for Innovative New Diagnostics, with the development of a tool that assists countries on a stepwise basis with developing a National Essential Diagnostics list. And we have developed the first version of this tool, and we're now rolling this tool out in Zimbabwe and in the Gambia. And that is why I'm here this week, because I'm introducing the tool, the whole purpose of a National Essential Diagnostic list and everything.
Nice. Yeah. So how would you describe your stay here in the Gambia so far? And
Excellent.
The work you're here to do?
Yeah, no, I really enjoy it. I've been arriving on Sunday, and well, I must say that the people are very engaged in the workshop. They are really actively working on getting done what needs to be done. And I'm really positively.
I mean, that's every teacher's, let's say, when you're teaching people something and they're responding, they're participating, that's what everybody would want.
It gives a lot of energy.
Exactly. So maybe you can just tell us in a little bit how you think this whole package would be of benefit to the laboratory services in the Gambia.
The whole purpose of a National Essential Diagnostics list is to give guidance to the diagnostic services in the country on diagnosing the most prevalent diseases. On the National Essential Diagnostics list are diagnostic tests, which are in vitro diagnostics and imaging technologies that are needed to properly diagnose diseases. And with the NEDL, that's the abbreviation of National Essential Diagnostic List, you sort of prioritize the availability of the diagnostic tests for the diseases that are most prevalent in the country. And by doing so, you'll make, by implementing the NEDL, you make sure that all those diagnostic tests for those diseases are available everywhere throughout the country. So are available to the entire population throughout the country. And that is really the value of a National Essential Diagnostic List. It's really to give guidance, you know, because there's of course limited resources available for the diagnostic services, and you need to use them wisely. And you want to have as many people as possible benefit from the health services and the diagnostic services. So by making an NEDL, you prioritize the diagnostic tests towards the most common diseases.
Right.
And conditions.
So looking at the fact that laboratory services are one of the key ways that we can effectively allocate resources to health facilities, because if they're able to pinpoint the actual problems of, let's say, disease conditions that are present to them, and then you would be able to understand that needed resources will be allocated to those. And then it will also avoid duplication of efforts here and there. What are you expecting to see after a couple of months, or let's say a couple of years of this development at the end of the day? What would you expect to see from Gambian laboratory services?
Well, actually, what I would expect to see is an improvement across the diagnostic services in the whole country. So in many countries at the moment, diagnostic services are located at different levels of the system, but the best services are of course available in the big laboratories in the capitals of the country. And through an NEDL, you make sure that also those services are available, those high quality diagnostic services become available in the remote parts of the country, in the health posts here in Gambia. They will be able to test for all the diseases that are necessary to test for all the diseases and conditions that are out there. The people can just go to the health post, their sample is taken, and through the NEDL, it is now possible to make sure that those samples are tested and those patients get a good diagnosis for the condition or the disease they are suffering from.
So we know that WHO has an updated list in 2021, but they are encouraging all countries to take up. And I must say, FIND must have gotten an interest to bring this down to the Gambia. You might want to share with us how you got in touch with FIND.
Yeah, sure. So FIND, so if you think about this WHO EDL, the idea is that this is going to be adapted by countries into a National Essential Diagnostics List. But up to now, the uptake of this list has been relatively low. Only a few countries have developed their NEDL, and that is why FIND stepped in to look into why it has not yet been implemented in many countries. And therefore they developed this stepwise tool that really guides countries almost on a daily basis with developing a National Essential Diagnostics List, just to make the adoption of the International Essential Diagnostics List, the WHO EDL, easier for countries to transform into a National Essential Diagnostics List.
So, and this National Essential Diagnostics List, it's kind of like a guiding tool for laboratory services in the Gambia, which most people would always refer to when they want to offer services in the Gambia.
Yeah, and it's both laboratory services and imaging services as well, because that's often that's important to mention. That I mean, in the laboratories you have your diagnostic tests for the in vitro diagnostic tests, but imaging service is also a very important component of the diagnostic services provision for many conditions that are around. So that is included as well.
Nice one. So let's say one last question before we leave you. This tool that you're developing, is it prone to changes at any point in time? Do you have a specific, let's say it should be changed annually, or let's say biannually, something like that?
You mean the NEDL or the tool?
Yeah, the tool that you're developing here.
Yeah, so the tool is now being tested here in Gambia and Zimbabwe, but this tool guides the country with developing their NEDL, so that their NEDL becomes is really reflecting the disease prevalence in the country and everything. And we will be continuously improving the tool. FIND will be coordinating this. But if it comes to the NEDL is also a living document. That is, I think, important to stress because you know the disease landscape is continuously changing. Like for example, we had the COVID-19.
And you're seeing new cases of different diseases that were not available.
I mean the COVID-19 pandemic is of course a good example of that. We didn't know about it in 2018, 2019, and suddenly it was there.
So I think that was why in 2021 WHO had to put up another NEDL at the end of the day. That had to also contain some aspects of COVID-19 tests as well.
That's one of the reasons why you would continuously revise your NEDL, because indeed the disease landscape, but also the diagnostic market is changing. Of course, you get new tests available every time. Maybe based on your implementation of the NEDL, you will learn some lessons that you need to incorporate in the new version of the NEDL as well. So by continuously revising the NEDL, reviewing the implementation and revising the NEDL, you make sure that it really suits the actual reality in the country, and that it most optimally suits the needs of the population when it comes to diagnostic services.
So along the line, when you were talking about the countries that you've gone to prepare this tool, did you mention Zimbabwe? Yes.
Yes.
So I was thinking like the development of this tool would kind of differ from the different countries since we are witnessing different activities in our laboratory. That's right?
Yeah, that's right. Yeah, this is, and that is why I'm here this week, to assist the National Essential Diagnostics Committee of Gambia with developing their plan for developing the tool and implementing the tool to really suit the other initiatives that are ongoing. I mean, they have the health services benefit packages that are currently being developed, and of course it would be nice if everything complements each other and feeds into each other.
Thank you very much for being with us. Maybe you would want to share some last words before we would let you go. Do you have anything to say?
Well, thank you very much for your willingness to engage on this process as well. I mean, I'm very glad to be here, and thank you very much.
Right, thank you very much.
Who can do what, and what data do you already have available? Which databases can you scrutinize? And try to collect as much data as possible. Now this week you have the time dedicated to this activity, so please do as much as possible in the time you have available this week, because next week you will already be, you will of course go back to your workplaces and you have other activities as well, so use this time wisely, so that you can really make progress towards determining your priority diseases and conditions. And the same here for the other expert groups. The people in the other expert groups start working on these activities. So take the e-tool, read the activities and the steps in these activities, and see what you can do in order to complete as much as possible already this week, so that you really have a head start. Is that clear for everybody?
If we don't have essential diagnostic list, we don't have specific laboratory services delivered at different levels of the healthcare service delivery, it will be difficult for us to implement the health insurance scheme. This is very much in line with the government move towards improving healthcare service delivery in this country. I think all of us, what we've shown here during this week will continue, and we will add more, we will sacrifice more, and we will put more effort into the development of the operational plan. This cannot be done by one person. All of us have to put our efforts together. We have to work together and then put our country first so that we have this document for the Gambia. We are making history, and our names will be in the books of the people who have first developed this list, and then I think we need to do our best to make sure that this work is done.
Now we want to thank Dr. Tijit for his firmness in moving to the last dot. Together with Ezekiel, I want to thank him also. It took time to put the proposals together, and the director did a lot, and Yaya also contributed in putting some points. And when we were developing the proposal, the senior team, we shared the proposal to all of you, and we also thank you for your comments. Now, your work has yielded through a lot of fruits today, and this is the fruit of the hard work that has happened in the in the undercover sort of, today we are now showcasing what has happened. Now, coming down today to the meeting, the director has already made mention. We are so happy with the methodology that you have to pass this tool to us. Now, teaching by action is the best way of teaching, and teaching by people-centered is the best way of teaching. I was very happy when people came here to put the things together when they have no knowledge about it, using their experience, because most of them are experienced, to put things together. And the debate that happened, whether situation analysis between situation analysis, that is step 2 and step 3, is good. But that's the way you can easily make people understand and appreciate their participation. Now, we're really happy, and for our colleagues here, we are really moved by the energy you have. Because I've seen sometimes when you tell you to go and eat, you are still with the work. Because passion has more power than hunger. When you're doing something and you are so passionate, you forget about food sometimes. And we hope that that energy will go throughout the 5 months. We're really happy also with your own, some of you who volunteered to be a care person, and some selected, some volunteered. Now, it's a heavy task, and a lot is needed from you. I want to thank all of you once again, and also thank the coverage, the team around here that is doing the coverage, the journalists here. We are really happy about it, because we need to showcase what is happening. This insurance seems to be an illusion or abstract to many people. Now, we need to break the ice now that the benefit package is finished. Now, but the National Diagnostic List will be a manual. What we are developing will be a manual, that from which the insurance even will buy from. And that will also dictate our procurement. The lab, we've really suffered sometimes in trying to make procurement. Because if you have not premeditated what you're supposed to buy and know your disease landscapes, then it becomes difficult for you to factor what to buy. Now, this is a win-win situation, and it will go a long way to fix our labs once and for all. And I hope in the distance to come, I was told by our veterans that the Gambia was a center of excellence then for lab. Now we want to regain that excellence. I think all of us are ready for that. Thank you so much. Yeah.
Those remarks, I think it's very clear that we have a responsibility. We try our best to get on top of our responsibilities. Just a few things to add, that is the lab staff and any other healthcare worker, we are all coming together, combining to lay the foundation of laboratory service in this country. The lab staff, we may think that we are not doing much, but I think we are moving in the right direction. A lot of work has been done. I think those who know lab service, you know that what we are doing is we are laying the foundation of a quality laboratory service delivery. Without your systems in place, you cannot have a quality laboratory service delivery, and then you cannot get accreditation on all what you are doing. So these are things that we are on the journey to get accreditation for our services, such that whatever we are doing in the Gambia, it will be recognized internationally. And this is one of the things that we have to put in place in order to get to that point. Once again, thank you very much.
I'm very pleased and have always been to be part of this group. Laboratory work and laboratory service has been my profession from when I graduated from high school. And that's many, many years ago. Probably some of you were not born. We've been through a lot, and I've worked in different environments. The foundation had been laid for some reason or another. There was like an interruption, what we'd probably call a hiatus of something. Things have gone down. And we all have a responsibility to the profession, to the nation, to our people, to improve the diagnostic services. And this is what the journey is about. I am extremely impressed by the knowledge, the energy, the commitment, and the dedication of the leadership currently in charge of the labs. Whatever is in, they are highly dedicated. they are responsible and they want to improve the services.
Now we would like to invite our senior Mr. Barrow to award the certificate to the participants. Mr. Barrow, I think those who were part of the policy development, the strategic plan, and all the documents that we have developed. Anytime we invite him, Mr. Barrow will answer to our call. So we are very grateful. Yeah. We are very grateful to you, and then we recognized the contribution that you are making towards the development of laboratory service in this country. Our arms are open. We still need more from you. We know that we have a lot of experience. So those experiences we want to get from you so that we can incorporate them into the development of laboratory service in this country for all of us and for our beloved nation.
We appreciated your efforts. Welcome Andrew Demba, Head of Biomed Unit. We are so moved with Professor Atiku. We really appreciate Mamadou Diallo, Senior Laboratory Scientist and Head of the TB Reference Lab. Babu, the Lab Manager, Kanifing, Principal Lab Scientist, Kanifing General Hospital. You are welcome. We appreciated your service, Director. Field epidemiologist, working with the epidemiology department. You are welcome. Haruna Jallo, Head of Microbiology Lab. From Abdullah A. Jallo, Fajikunda Health Center. You're welcome. We want to welcome Dr. Abdul Hamid Kante. We really appreciated the time. Okay, Dr. Idrissa Jao, a senior medical doctor from Bansang General Hospital. We appreciate your time also and contribution. We are also inviting Abu, senior lab scientist. Okay, we want to invite Yaya Bajo, principal health economist. We appreciate your time, your support. Yeah. Mr. Fall, senior lab scientist. We appreciate your and Alphonse Mendy. We also appreciated your Seni BFCC, senior lab scientist. Alaji Papasi, our director. I think two of you can give him the prize. Tijit, come. We have had different consultants visiting us, and we've had developing different tools. But this tool has really made life easy for us. On behalf of that, we as a country, as a government, as a Ministry of Health, and as a Directorate of National Public Health Laboratories, wish to give out this certificate to him in appreciation of his effort in developing this tool for the world to benefit and choosing Gambia as a pilot. On that behalf also, we want to extend our thanks also and appreciation to FINE for funding this project. Please, can you come and have this slide? Yes. Yeah.
First and foremost, I want to thank the consultant. He make our life very easy because this is the first of its kind. I attended a workshop like this. The consultant make life easy for us. When I look at the timetable on Monday, I said, wow, this is too hectic. I don't think we can make it. But after his presentation, I mean, within 2 days, we were able to finish the task. So we are very grateful. Secondly, I would like to thank all those who are here today, especially my boss, Mr. Malamin Barrow, all those who come from other facilities, we know that all of you are very busy, but nonetheless, you were able to find time and come and honor this invitation. This is first of its kind, and I think it's going a long way. We've just started the journey, and we know that you've all committed yourselves to be here. The 5 days have been very much, and I don't think you will stop here because we've just started. So let's endeavor to continue the way we started this week so that we can achieve our goals. And if we achieve this, it's going to be for the whole nation. I would like to thank the director, Dr. Sirifo Jany, and the deputy director for the good leadership they've been showing us since they took over this facility. So we are very proud of you people, and thank you very much. I'm honored to declare this workshop closed. Safe journey home, everybody. Thank you so much.
Since we've witnessed the end of the whole workshop, maybe you can tell us who you are and what you've benefited from this training.
Okay, my name is Professor Tino Agunloye, the head of department and consultant radiologist at Edward Francis Small Teaching Hospital.
Nice. Your stay here during this week, how helpful has it been?
The workshop was to teach us and train us on how to develop the National Essential Diagnostic List. And I'm particularly glad to be here because when people hear the diagnostic list, they usually just think of the laboratories. But we all know that imaging, which we call radiology, which includes X-rays, ultrasound, MRI, CT scan, is also another part of diagnostics. So I'm glad that for once now, this is being brought into the diagnostic list for the country, and we are being carried along from the beginning. So it's been an exciting week and period.
Yeah, I can imagine that all over from the certificates that were presented to all of you. So from this stage, what is the next stage for all of you here?
Okay, so now the consultant has taught us what to do. And you know that for the country to own its own list, it's better that the stakeholders and those that are in the system develop the list themselves. So we've been taught how to fish. So now we're going to do the fishing and do the work, prepare the list, go around, take an inventory, and then come up with recommendations for the final NEDL for the country.
Nice one. So from the look of things, we were also informed that this is just the beginning of the bigger step. So we are aware that you've been divided into different groups that are going to come together and work. So what group are you and what is your task?
Okay, so of course I'm in the imaging work group and I'm actually the chairperson of the group. So now, starting immediately from this weekend and next week, we're going to do our own group plan, timelines, and we're then going to, first of all, do an inventory of what is existent in the country. So we'll be visiting all private and public facilities that use imaging. So anybody that has an X-ray, has an ultrasound, has a CT, MRI, mammo, we'll be going to see them to take an inventory of what they have, how many they have, if it's functioning or not. And then after that, we'll then assess the data we have and then write our report to the general committee. And we all have to work within the deadlines.
All right, thank you very much. All right, so we have another participant here from the workshop. Can you tell us who you are?
Hello, I am Maria Majame. I am a biomedical scientist and the program manager for National Blood Transfusion Services, working at NPHL.
Nice one, Mariama. So what are your reactions from this very important workshop?
This workshop is very, very important. It has been very, very successful. The consultant has done so much work to take us through a very new, a tool that is completely new to us. So the workshop is to develop the National Essential Diagnosis List for the Gambia, which has never happened. So, and this is very important for implementation and for quality. It's part of the laboratory quality system. Well, I would say the quality system to improve the quality system of the Ministry of Health. So it's been a very, very important workshop. We had different stakeholders. A lot of work have been done. We've gone through the tool, and work has actually started in trying to search for information regarding diagnostic services in the Gambia, and then the way forward.
Yeah, so talking about trying to search for information and the way forward as far as this toolkit is concerned, I know that you've been divided into several groups. What group are you and what is your role in that group? What are the responsibilities of your group?
So we have different expert groups, and I belong to two groups basically. So I am part of a group called the National Health Laboratory Services Group, which is basically responsible for looking for data for priority diseases, for diagnostics, what you call it in vitro diagnosis tests for priority diseases. And also I belong to the planning group, which is my main group, and I am the executive secretary of the planning group. So basically my group is responsible for planning for all the other groups. So we look at the activities of the other group and create timelines, assign people who are responsible, and when we expect them to report back to us, because it is us who should actually give feedback to the National Essential Diagnostic Committee, who will then report to the consultants and also the permanent secretary.
All right, Mariama, thank you so much, and we wish you all a very, very excellent work as you do. All right, we've been joined by the private sector as well. Let's get to see their reactions. Who are you?
I'm Malamin Barrow. I work for Health Diagnostic Laboratory. This is a private laboratory that does a lot of emphasis on cancer screening. To the extent that these people calling us to be part of the National Essential Diagnostic List, I think it's really overwhelmingly impressive, because basically this is going to form the core of what will be provided within the health service. So including both the private and the public sector together on what they do in terms of diagnosis is going to be very impactful on the delivery of healthcare. So having a conference like this is extremely important. Everybody put their ideas together to the extent that what will be provided in future for patients will be sort of available in the brains that have been put together to put up this list. So essentially, healthcare delivery will benefit.
Nice one. So we know you are a veteran and you've been quite supportive to the National Public Health Laboratory Services. What is your take-home from this very important exercise?
The take-home is I'm very impressed by the energy and the dedication of our young scientists. They're very committed, and they are very dedicated, and they're forward-thinking. I think given the way they are going, there's a bright future for healthcare in the country.
Thank you very much. He said there is a bright future for this country, and we look forward to something like that very soon. Okay, we've also have participants all the way from the different regions, and joining me right now, it's a representative from Banthang Hospital. Tell us what your reactions are from this workshop.
Okay, good afternoon. Thank you so much. My name is Dr. Idris Ajah from Banthang General Hospital. My reaction, I would say, is excellent because this workshop is timely. I mean, for so long, lab diagnostics have been neglected. And one of the things that will help in your diagnosis is, apart from your examination, you need labs to be able to arrive at your final diagnosis. So this National Health Essential Diagnostic List is very timely. It will also help to strengthen our diagnostic in the periphery. Places like Banthang with a catchment area of more than 600,000. You don't have all the luxury to be sending patients to the combos. You need to, it's a general hospital, so you need to try to solve your problem as much as you can in the region. So this is really timely, and I'm very happy to be part of it.
Yes, so talking about this being timely, and also we understand that this is just the first step as far as the development of the tool is concerned. What is your role and which group do you belong to?
Yeah, I belong to the group, the disease prevalence assessment expert group. Our work is to go in the field and try to find out what are the diseases that are more prevalent in our various facilities. So we are going to go around all the regions, North Bank, West Coast, LRR, CRR, up to URR. So each region, we selected some regions, teaching hospital, like the West Coast region. Certain regions, we don't have teaching hospital, we have only general hospital, others we have district. So we try to take as little as community clinics, health posts. We try to see what are the things that are available, what are the diseases that are prevalent in each facility, so we can come up with our final list of what the most prevalent diseases and the burden of disease is affecting our country. And we want to start the work as soon as possible, because we have a timeline for it.
All right, thank you very much for sharing. Thank you. Really appreciate it. So this is an activity that is just marking the beginning of the entire exercise of developing the tool for the National Essential Diagnostic List. From this workshop, they were able to prepare a work plan, and they were able to get different groups that are going to be engaged on different activities. We've had some of the participants discuss what groups they belong to and what their responsibilities would be as far as this tool is concerned. It has been a long week already, and we've come to the tail end of this very important exercise by the National Public Health Laboratories Services. We know developing a tool for the National Essential Diagnostic List is one of the most important activities that they can ever do, because this is going to inform laboratory services in the Gambia. And of course, it will also help us understand what to procure as far as health service delivery is concerned in the Gambia. And this will also help us understand the disease landscape we have as a country. As such, we are going to wish the National Public Health Laboratory a beautiful and successful exercise in trying to come up with this tool to help us guide our national laboratory services as far as health care delivery is concerned. As I draw the curtains on the show here, I am Sona Dabo, and I've been your presenter. Over to you.